Hi everyone, welcome back to my channel CodeMed Mastery. In today's video, we are going to see what is fraud and abuse in healthcare. The topics covered in this video will be what is fraud, what is abuse, and what is the difference between fraud and abuse, and also examples of fraud and abuse. And at last, we'll see the consequences of fraud and abuse. This topic is very important in medical coding as well as for your CPC exam. Let's start. Before that, don't forget to hit the like button, share this video and subscribe to my channel. First, let us see what is fraud. Fraud means deliberately deceiving or misrepresenting information to secure unauthorized benefits or payments. Fraud entails intentional misconduct and is subject to criminal penalties. For example, filing claims for services that were not actually provided, a practice often referred to as phantom billing. Now let us see what is fraud in simple words. In medical coding, fraud happens when someone intentionally lies or falsifies information to get money or benefits that they aren't entitled to. This can involve billing for services that were not actually provided, overstating the cost of procedures, or changing codes to get higher payments from insurance companies. So, this is a serious offense with legal consequences because it affects patients, healthcare providers, and the overall system. Next, let us see what is abuse. Actions that deviate from standard medical or billing practices without the intention to mislead. So, abuse typically leads to unnecessary expenses for payers but is less deliberate compared to fraud. For example, incorrectly using codes on claims due to limited knowledge or not adhering to proper guidelines. So, what is abuse? Abuse in medical coding is when mistakes or bad practices happen without meaning to cheat or lie. For example, using the wrong codes, charging for unnecessary services, or not following proper guidelines. Unlike fraud, it is not done on purpose, but it can still lead to extra costs or problems. What is the main difference between fraud and abuse? Fraud involves intentional deception, whereas abuse arises from mistakes or lack of understanding. It is important to remember that fraudulent and abusive practices in medical coding and billing can lead to severe financial losses, legal consequences, and negative impacts on both the patients and healthcare providers. Let us see few examples of fraud and abuse. Examples of fraud: phantom billing, that is submitting claims for services that were never performed, and upcoding, that is billing for a more expensive service or procedure than what was actually provided, and unbundling, that is separating procedures that should be billed together to increase reimbursement. So all these are the examples of fraud. Examples of abuse: first one is coding errors, using incorrect codes due to lack of knowledge or not following guidelines. Overuse of services, performing medically unnecessary procedures that lead to increased costs. And lastly, billing mistakes, that is charging for services without ensuring proper documentation. So all these are the example of abuse. Lastly, let us see what are the consequences of fraud and abuse. It will lead to money penalties. Organizations might have to pay big fines, sometimes from thousands to millions of dollars. Next, legal trouble. People involved in fraud might face legal cases and even go to jail. Banned from programs. Those found guilty might not be allowed to take part in programs like Medicare or Medicaid anymore. Damaged reputation. Hospitals or clinics might lose trust from patients and the public, which can hurt their image. Lastly, more audits. Organizations caught in wrongdoing may have their actions checked more often by auditors.